Hello and welcome to the Dental Protection Podcast. In this episode, we're bringing you previously popular conversations concerning various junctures or periods in a typical dental career journey. I'm your host, Dr. Noel Kavanagh, a senior dental educator at Dental Protection, and in this episode I was joined by Dr. George Wright, a dental legal consultant and a deputy dental director at Dental Protection. George and I discussed the topic of exiting practice, and we explored some of the potential risks associated with retirement involved in selling a practice, as well as providing some helpful risk management strategies.
Thank you, Noel, and delighted to join you again and really looking forward to hearing your thoughts and views on this topic of exiting practice. I think perhaps exploring some of the potential risks associated with retirement, involving selling a practice, as well as providing some helpful risk management strategies. I think also worth bearing in mind that individuals will be taking breaks from practice for whatever reason, perhaps career breaks, maternity leave, and so there'll be other times as well where one might exit a practice. So can I begin our discussion by asking what some of the most common exit strategies are open to dentists?
Yeah, certainly, George. I mean, when planning your exit from practice, some of the possible options open to you might include selling up and retiring completely, selling with a contractual earn-out over a specified number of years and staying on as an associate, selling and staying on longer term as an associate in the same practice, either full-time or even part-time, or perhaps even as an associate elsewhere. And possible purchasers for the practice could be an existing partner or partners, existing associate or associates, perhaps even a new practitioner, a dental group, or even a non-dentist.
Okay, so let's stay with the first one there of selling. What considerations should one have when thinking of selling a practice?
Well, it goes without saying that time invested in planning your exit strategy is time well spent. So rather than winding down when you're approaching retirement, this is perhaps the time to step up preparations to give you the best chance of an anxiety-free departure. And this needs to commence well in advance, to say even up to 4 years ahead. It should include reviewing and establishing patterns of best practice.
Right. Okay. So let me pick you up on that final point. What best practice do you have in mind specifically?
Okay, well, a good example would be your record keeping. Auditing sections of your patient records is a useful way of checking that they include all the relevant information. Another important consideration concerns access to patient records after a sale. There is no statutory basis for this in Ireland, but it's widely held that, unless it's agreed otherwise, records are owned by the practice and will pass to the new owner. So if you're selling the goodwill or the complete practice, agreements should be put in place to allow the departing practitioner to have reasonable access to the records of former patients. Should this be required, for example, maybe to deal with a future complaint or a query about past treatment? It should be remembered, of course, that the new owner will become the new data controller and will therefore need to comply with current data protection requirements when access is requested.
So other than the record keeping, what other areas of preparation are useful?
Due diligence and compliance need to be undertaken, including reviewing your regulatory compliance standards. So, for example, your infection prevention and control policies and procedures. You'll also need to get early and expert professional advice. And that's concerning things such as timing of the sale, contractual arrangements, the financial, business and tax arrangements, employment law, and even pension arrangements and investment of capital received.
And I'd imagine that from a risk management perspective, it's very important to carefully consider each potential purchaser.
Absolutely. I think a critically important consideration is assessing whether you feel a potential purchaser will be, a good fit, for want of a better term, both personally and professionally. And will they maintain the clinical ethos of the practice, for instance? It's so important to recognize or appreciate that an acrimonious sale carries risks, and that could end up leaving you more vulnerable in the long term to criticism, complaints, or even allegations of negligence. So I think it's very sensible, therefore, to cultivate a good relationship with the new owner, because their approach to dealing with patient issues arising maybe from treatment previously provided by you is likely to be influenced by their interactions with you. And issues, can often be diffused or aggravated as a result of this.
Thank you, Noel. So you referenced earlier that one possible option when selling your practice is staying on as an associate afterwards. Now, I think this is perhaps an increasingly common scenario, and it might be useful, therefore, just to highlight some considerations when transitioning back to an associate and also, I suppose, any areas of potential concern or conflict.
Well, things to consider beforehand include possible loss of control or autonomy. So, for example, will you enjoy full clinical freedom? Equipment changes may bring on familiarity and potentially, again, increased risk. Similarly, with types of materials used, will there be any choice? And it can definitely be very unsettling if you're forced to change maybe from your preferred lab that you've used over the years. And it's quite likely that you may find yourself having new working patterns potentially carried out in a new environment. This might include being expected to work in different surgeries and maybe even different clinical settings, and even having different nurses and different hours. Perhaps you're looking forward to more time away from the practice with a reduction of hours or an increase in holidays. So no longer being the boss, that can undermine this aspiration. Also a new owner or owners, they might introduce targets or KPIs, these key performance indicators, and this concept might feel very alien if you're not familiar with using them. And adapting to new systems and policies, that can also prove very challenging, as they mightn't make sense to you, or perhaps you don't even agree with them. So once again, if you're used to being the boss, to being in charge, it can be difficult to adapt to someone else's directions.
Thanks, Noel. So some very useful thoughts there. And to address these concerns, can I ask you to share some of the risk management strategies with our listeners?
Yeah, certainly. Firstly, I think it's essential to obtain good legal advice and to have, a robust legal contract of sale, and also, a robust associate agreement drawn up. This is not an exhaustive list, but just some of the items to consider addressing in those contractual terms. Things such as payment methods, whether you retain any administration responsibilities, and obviously your working hours. I think it's good practice and also prudent to put contractual arrangements in place for dealing with your relationship with your successor and remaining partners or practitioners, and also the withholding of funds for remediation of treatment where necessary. Contracts should also include agreements in relation to communication, both with patients and about complaints, with suppliers, labs, and even with local colleagues and practices. But I think, another thing to really, to ensure there's absolute clarity and understanding of each other's expectations from the outset. So, what are you looking for in your new role? Is there an expectation, or perhaps even would you like, to remain as a clinical lead? Do you wish to have any input into how the practice is run? Would you like to be in an advisory role to the new principal? Or would you just prefer to take a step back and, to step away from that?
Okay, thank you, Noel. I suppose that's very, individual specific. Everyone has different perspectives, what they want to get out of that transition. Now, as in all areas of risk management, a central pillar is good communication. And I presume this is no different at this career point.
I couldn't agree more, George. It really is a central pillar. And I think, it'll involve communicating with both your patients and also your dental team, because, that'll help maintain confidence in you as a leader and clinician, which is essential during the changeover and transitional period. It's more easily managed if you're staying on after the sale, or if the new boss, in inverted commas, is well known, maybe an existing associate or an existing partner. If it's neither of these scenarios, I think it could be prudent to consider a transitional period. So perhaps you could also consider sending a letter of explanation or clarification to your patients. Because if you just disappear, off into the sunset, patients may feel let down or abandoned. And this disappointment can then potentially lead to receiving complaints or claims.
Thank you, Noel. I think that's a theme that we have touched on throughout the past couple of podcasts as well, how central communication is to this. And the other pillar that we've touched on perhaps lightly in the previous two episodes was expectation management. Now, I think that probably takes more of a focus in this situation.
Yeah, absolutely. It's something, our listeners probably have heard us, chatting about on a few occasions. And we often talk about managing patient expectations. However, this time around, I think it's probably more a case of we're managing, our own expectations, because, I think it's useful to expect a period of adjustment for everyone. There may be changes in culture and style in the new, in inverted commas, practice. And finally, just knowing, I think, when to step back is crucial, because, there's a very fine balance between, helpful input but also the perception of interfering or even perhaps undermining the new owner.
Yeah, absolutely. And I suppose for new owners as well that perhaps haven't got that experience of being in that position, having that mentorship as well, and that opportunity of that expertise and that experience can be quite valuable as well. So some really helpful points there, Noel. And as always, it's been a real pleasure to hear your thoughts on this topic. And on that note, Noel, I'd like to thank you once again for sharing your thoughts and as always, very practical advice. Thank you for listening to this podcast. I hope you enjoyed it. And if you have, please do tell your friends and colleagues. We're always interested to hear from you, and do let us know if you have any ideas and suggestions for future podcasts. Otherwise, thanks again for listening.